Hi guys, Martin DeFleeger here. I want to thank you for watching and clicking on this video today. I want to talk today about Trikafta, the new miracle drug that's approved in the States and people have access to the States. But us in Canada do not have access to any modulators of any kind yet or coverage and access to Trikafta ultimately. So I want to talk to you about today. But please share this video, like, subscribe, hit the button below. Leave comments below as you're watching this video so others can see what you're doing to fight. Together we can band together and we can win this fight. So I want to just give an update for all CF patients in Canada and around the world where we're sitting in Canada when it comes to Trikafta. There's a lot of misconception, a lot of rumors. So I decided to reach out to Vertex, and I had a phone call with Vertex Canada this morning. She told me that as it is for now, they have not put a Health Canada application in. And I asked her when. She couldn't give me a date. Obviously, they're not going to tell you that. She did tell me that they're waiting to hear back from what the guidelines in the new drug formulary that the Liberal government have voted in on drug coverages for such diseases as cystic fibrosis. She says, as it sits now, if they're only going to pay between 40 to 70%, from what I read between the lines, they're reluctant to do business with Canada. So what we need to do is we need to make it easier for these companies to work with Canada. And Canada has to get rid of their red tape and make a rare disease drug strategy. How can you guys help? You guys can help us write letters to the government, share this video. We can write our MLA, talk to our local representatives, and we can start a movement. We need to be heard. We're a small population of cystic fibrosis, but we do not deserve to die when people 100 kilometers over the border are getting access to life-saving medication. This is wrong, and this needs to change. She did also tell me that provinces individually can reach out to Vertex. For a long time, the government's been hiding behind that it's a hard, long process. She told me that all they have to do is reach out to Vertex, and Vertex is willing to sit down and make a deal. So to our local governor, Tyler Chardonneau, to our local Premier, Jason Kenney, let's work on this together. You know, these are people that are dying that could contribute to your economy. We have to look at it as a whole business case, not just as one number for one patient. These people can contribute to society. They can go back to work. They're not going to be taking up hospital beds, costing huge amount of money in hospitalizations, because this drug has done miracles. People have seen 20 to 30% lung volume increase and feel good and can live a normal life. So economically, it makes sense. So let's get off our high horse. Let's work together. Let's work with Vertex, approach Vertex, and push our Liberal government to support rare disease. We live in this country. We have a right to access to medication. Our Liberal government helps people from all other countries, donates money to all kinds of associations, refugees, everything. And I think that's great. We're a caring country. But don't forget about our own. Justin Trudeau, don't forget about the sick people that are dying in this country because you are reluctant to make a strategy to get these drugs approved. And on the flip side of this, I want to talk a little bit about Vertex. Vertex also needs to stop basically holding Canadian and other governments hostage until they basically come with a blank check. Your drugs are very expensive. I understand business. I understand that the R&D costs are huge over the last couple of years. And I understand you need to make a profit. But to rape the patient that is dying and take advantage of them because you know that they'll fight for anything to get it is wrong. The shareholders should be ashamed of yourselves. I understand you need to make money, but to go this far and charge $300,000 for medication, this is my opinion, is wrong. So Vertex, get off your high horse. Canada, get off your high horse. Let's get together. Let's work together. Let's make this happen. Not in 6 months, 2 years, 5 years. Drugs have been approved here for 5 years and nobody has access. This is wrong. When a drug goes to the US to get approval, 6 weeks, 7 weeks, it was approved by FDA. Within a week, people had this drug. Come on, Canada. We live in a great country. Let's treat our citizens like they need to be treated and let's care about them. Justin Trudeau, let's care about them. So I'd like to thank you guys for watching. Please, like I say, leave a comment below. Let's work together. Let's start a string of comments where we can all give ideas, put our passion and our efforts together to get change, to save lives. My daughter deserves me to see her graduate. My son deserves me to see him go to college. This probably will not happen for me if we do not get access to this drug. People are dying on a yearly basis, monthly basis with cystic fibrosis. They're on lung transplant, on the lung transplant list, where if they had this drug, they could get off and save millions for the government. It makes sense. So let's work together. Like this page, share it, give it to the whole world. Thank you for watching. Have a great day. Keep in touch. Watch for my next videos coming out and have a great day. Have a good one.